Okay. Go ahead.
So how many of you have heard about Doctors Without Borders before? I actually haven't until I did this project. But according to doctorswithoutborders.org, 2017 in Nigeria in 2010, at a place where there were people located, they were helping people in a village, and within 3 months, 40 children died from unknown causes. But what they did know was that they had severe fevers and were having seizures. So what they did was they decided to investigate, and they noticed that mothers were mining with babies on their backs. So what they had to do was crush big rocks, and it would send dust flying everywhere. So they thought oh, this is what the babies and the mothers must be inhaling. So they decided to test it. And when the results came in, they noticed that they had high amounts of lead, and they ruled the deaths as lead poisoning. So by 2012, they saved 2,000 children's lives from lead poisoning. So Doctors Without Borders is needed everywhere because it treats people with very preventable diseases and provides healthcare to people in unreachable places. So today I'll be talking about why Doctors Without Borders is needed, what they're doing to help, and their impact. So first, I'll be talking about why they are needed. According to the biggest threats to child mortality in the third world, 2017, people, especially children under the age of 5, are dying because of malaria, measles, and pneumonia, which are all treatable and preventable. And especially children are a lot more likely and susceptible to getting these diseases, especially when they're malnourished. And children are mostly at risk. And according to Children Reducing Mortality 2016, 45% of children in third world countries under the age of 5 die because of these diseases. So what they're doing is they're trying to help especially children from preventable diseases. So otherwise, if they weren't there, then these people would die from just things that are easily treatable. So now that I've talked about why they are needed, I'm going to discuss what they are doing to help. So according to Doctors Without Borders puts skills and experience to use around the world. 2015, they send teams of doctors, nurses, and volunteers. They provide emergency health care. So what they're trying to do is they go to places where there are epidemics, there are wars going on even, and they try and provide as much health care there. And according to doctorswithoutborders.org 2015, they have delivered, they help deliver a lot of babies, and the rate of women that would die in childbirth was very high, but they got it to drop 74% within a year of helping them. So now that I've talked about what they are doing to help, I'm going to discuss the impact. So according to Doctors Without Borders Humanitarian Quest's Unreachable Dreams 2014, mortality rates have dropped significantly. Every day, 1,500 people in third world countries die from malaria, so that's what their main goal is. They prevent the spread of diseases, and they cure many people of these diseases. And according to doctorswithoutborders.org 2017, they saved many lives in emergency situations. Otherwise, these people are so far away from the healthcare facilities that they do have that they would otherwise die. So now that I've discussed the impact of Doctors Without Borders, Doctors Without Borders is needed everywhere because it helps people in unreachable places, like I said, and They provide healthcare and medical care to people that can't afford it and who need it the most. And I've discussed Doctors Without Borders, like what they do, what they are, why they're needed, and their impact. So if you want to help, you can visit doctorswithoutborders.org, and you can either donate money or you can choose to donate like actual medical things to people. So thank you.